Good morning and welcome to Conestoga College. My name is Gino DePinto and I'm faculty with the Respiratory Therapy program here at the Doon campus. I'll be your narrator and guide through this clinical immersive exercise and also be touring you through different elements of our fantastic facility here. Shortly we'll be meeting individual key players that are involved in this event, and it should be a lot of fun and hopefully you enjoy what you see here. So we're also in the Cowan Health Sciences Center and we're celebrating 50 years of Conestoga College. We're celebrating 10 years of graduating respiratory therapists from the college, and we're very proud of this event that's been going on for the past 10 years. So I'll be flipping the camera now and I'll see you once the event is over. Alright, so we'll introduce on here is Carl Weiss, our simulation coordinator.
Hello.
So say hi to everybody on Facebook.
Hello everyone on Facebook.
Alright, so we'll be entering into the Cross Center for Simulated Learning.
Yeah.
And I'll have Carl kind of describe the event.
Yeah, why don't we head in. So firstly, I just want to preface that what you're about to see are learners in action. So will you see mistakes? Probably. We're going to see the gamut from some really brilliant successes to also possible wheels falling off the bus moments, the whole spectrum. So the goal here is to really immerse learners in situations that they can't necessarily or can't be guaranteed to effectively have within the clinical setting, along with some clinical experts from that clinical setting so that they can reflect on it. So why don't we head in and just kind of see some of the things that we're doing here. We'll kind of keep our volume down here, but we will head into the control room, so we'll be able to talk a little bit more. So come on in. We're just entering into our pediatric critical care unit here. So we're passing a couple of the rooms. You might see some of the learners engaged in some of the activity. We've set up our hallway here to kind of represent their equipment and PPE and sort of the things that they would need to enter into the environment. So we have two setups. This room is here as one of our cystic fibrotic patients. This is her room, and that's Erin. There she is. Hi, Erin. Sorry to interrupt. Just watching a movie. Come on down. We'll head over here. Over in this room. Should we go over in the room? Can you see it there?
We're going to go into the control room now.
So just to set up, this is our control room where we can control the physiology, we can control the recording of the events so that we can review them later. We also have a couple lungs over here that are acting as spontaneous breathing mechanisms for some of our patients inside the room. Over here we have Jen Barton, our manager of our clinical practice. We have Tyler Robilski, here's our sim specialist, and also graduate tenure program. And you're controlling some of the physiology and recording, so you can see some of the activity that the learners are. What are they preparing for?
We're just about to extubate right now.
Okay, very cool. So part of this is a 3-day immersive event where learners are immersed in the practice of pediatric care in both the critical care environments and in the emerge environments. And they are just completing their 3-day event here. So I think we have some blood gases ready to go to be printed. Yeah, so things are looking pretty good. How are we doing over on this side?
So this is Jessica Bernard, also graduate of our program and simulation specialist. She will be controlling some of the pathophysiology with the case that we will be following shortly. So in the room here we have subject matter experts, Ernie Matchett and Jordan McTavish. They are respiratory therapists from London Health Sciences, also work on the transport team and the pediatric critical care unit, and also a little bit of time in the NICU or the neonatal intensive care unit. Also in the room we have Blair Walker, who is our nurse technologist, who also spent some time in the emerge at London Health Sciences, and then our students Annalise Andrews and Laura Kessel. So they are right now just about stabilizing our 4-year-old motor vehicle accident, and we'll be joining them shortly in the middle of their scenario. So how are we making out, Jessica? Are we
Good. They just got return of spontaneous circulation, and they're doing their primary and secondary check.
Awesome.
And then they should be calling for OR in a minute.
Okay, so what you're going to see is we'll join them. This particular simulation has been twofold. One was to stabilize a CTAS-1 emergency kid with was in a motor vehicle crash who required intubation, who went into a PEA. They discovered that they may likely be bleeding internally, and we're doing an emergency transfer to the OR. They're going to be received by Pam Hall, who's faculty member here in the RT program. She's going to play the role of Dr. Waters in anesthesia. Jordan's, you might see a switcheroo, so he might be in here, but then you might see him also in the OR. He's going to play the role of an OR RT or an AA in that environment to help the learners get prepared for that environment. Our goals of this particular transport are just around airway management. Have they ever managed one of these? No, they haven't actually done a pediatric transfer. So the goal is to try to create the realism around it, and we will see how it goes. See how it happens.
So this is their third day of clinical immersive simulations. Students have spent time in the emerge environment, and Carl showed you earlier the pediatric critical care unit. So this is their final simulation, and then this afternoon they'll spend some time with our subject matter experts going over different skill sets like oxygen therapy, suction therapy, cough assist, vent management at LHSE. So students will now be prepared for their clinical shifts at London Health Sciences in the next 4 to 6 weeks with this preparation. So we've seen a lot of value with this. It's been a great partnership with the London Health Sciences Children's Hospital, and we hope to continue this going forward.
Conestoga General Switchboard, how many are
So I guess we can enter in the environment. I'm going to enter and play a role of a porter in the environment. So that's
Sure,
who
I'll
you'll
send
see.
it right over.
I'm going to transform now. There we go.
All right, so let's enter into the environment and meet our students. And I'll stop narrating at this point and join you
We can do the
once the
mock roll.
scenario is over.
Yeah. They're in the process of doing the mock roll. So let's see how it goes.
Say roll before we roll. Okay.
Laura, watch that too.
Yep. You good?
Okay.
Is everybody ready?
Yep.
Yeah.
Okay, on 3. 1, 2, 3. Over.
Okay.
Back looks good.
Pull
Okay. Feel each final process. Yeah. Pull that board out. Down. Excellent.
Careful, guys. Careful.
Yeah.
Perfect.
I see no glass.
Nope. Good over here.
I
Yeah.
am
Okay, are we good to go
Kyle
down?
Porter.
Yep.
Yeah.
On 3.
Yeah.
1, 2, 3.
Okay.
Back.
Good.
Good.
Okay.
Chest still moving well?
Yeah.
Do you want me to call trauma surgeon?
Yes, please.
Okay.
Thank
You guys, I need
Ms.
those
Watson.
sandbags or rolls back, please.
Yeah. Let's get those back in. Maintain
Just there by the
ceasefire.
monitor.
Yeah.
Okay. So that's about 98. So we're starting to top up a bit there. We're at about 110.
I'll slide this hand out. Other hand out.
Perfect.
Dr. Waters,
There.
tape.
Yeah, we have a
Alright.
patient down here in trauma 2, the 4-year-old boy who was in an MVC in his car seat.
Make sure that tube's good, secure.
On that side.
Okay, we probably have a bleeding happening. We're probably hemorrhaging. So I think we need to go to the OR stat.
Okay.
We need to pack up and transport out. So what do we need to do a good transport
How
out?
about you get ready for transport? Okay, I'll help with the tape.
Okay.
Okay.
Sounds good.
All right. So what do we need there, Annalise and Laura, for transport out? Okay, grab a tank.
Okay, we'll get him on
Let's
the
get a
Okay, so
tank on the bed.
I'm gonna undo this, and then I want you to hold
Got it on this.
OR's ready for us as soon as we can get up there, the better for them.
Okay, perfect. Good stuff.
Hey, Roxy.
All right.
Okay.
We're not going to wheel that. Annalise, throw it in the carrier.
Okay,
And,
gotcha.
yeah, throw it in the
Sure,
tank.
where are we taking that?
Do we have enough oxygen?
We're just putting
Yeah,
down that
we're
option
Okay,
too.
because we're going in an elevator. Last thing I want to
Okay.
do is get stuck and not have enough oxygen. Okay.
And oxygen's on flush
Yep,
right
you
now.
can throw that in there. Yep. The other way.
Okay.
Yep. Good. Excellent. Yep. All right.
We're good with meds.
Yep. Okay. Laura, are we still moving the chest fine?
Yep, we're still doing
Okay.
good.
Yeah. Hold on to that too. Okay. What else do we need, Annalise?
So do we have like an intubation kit? in
Yes. Make
case?
sure you grab all your intubation stuff and
Stuff.
grab the
They're over
scan
there on
box.
the tarp.
Yeah. Grab that scan box. What else do we need?
We're at 50 at the teeth
What
still.
what rhythm did we come out?
I got it for you.
What heart rhythm did we come out of?
You looked like he was.
It was PEA, so last thing I want to do is go back into that, so we need emergency meds on the route. case something happens.
I've got
There's
meds.
crash carts throughout the hospital, but we need to have a drug bag with us, okay? We're not going outside this room without that drug bag.
You switched over to here.
Yeah. Okay, you got the scan box, you put all the stuff in there?
Yeah, I got it.
Airway equipment?
Yeah. I got
Good.
it.
Okay, monitor's hooked up. Okay. So what have we not done for a while yet?
We haven't reassessed.
Okay, reassess. So what do you want to reassess?
So, pulse, blood pressure, circulation.
How's the airway? Is it secure?
It is secure, yeah.
Moving that chest still?
Yep.
Okay.
We have the teeth.
Did you listen to the chest?
We'll put this behind here, yeah.
Okay, have a listen to the chest, make sure that tube doesn't move before we go. And what else do you want to check there, Laura?
So we need a blood pressure.
Okay, great. Great,
Still getting bilateral air entry.
great. Does anybody put a hand on the pulse? How are the femorals?
Strong.
Strong?
Pulse, yeah.
Okay. So we've got our scan box, we have a drug box. Tube is secure.
Yes.
We're gonna check our blood pressure, how are we
I
doing?
got a blood pressure like 78.
Oh,
So we're
boy.
thinking-
So,
Okay.
yeah, what do you wanna do there?
Should we start an imatrip before we go?
We don't have
no.
time right now, but we
Okay.
can push fluid right now.
Fluid, okay.
So how much fluid do you want?
Another 200 mils?
Okay,
200 mils?
good.
Yeah.
20 mil per kilo, normal saline.
Okay.
We'll get that in, nurse Roxy's on it.
Yeah, we got it. I got another bag in case
Excellent,
we run
okay.
out.
So we'll do that on the move.
And
Roll
we'll
the,
set the disconnect and back to the tank.
okay,
Oops, sorry.
You good?
Yep.
Okay. Kyle, you ready?
I'm ready. Let's go.
okay.
Just need to.
Helpful, it doesn't
Let's
take
get ready to
Yeah, yeah.
disconnect and attach to the cylinder.
Okay, so you're ready? Just tap it.
Okay.
How you doing, guys? Ready to get moving?
Yeah.
Did you guys want to bring the backboard, or are you guys okay without it?
Let's bring
We got
it
the
to
red
the
board
show, yeah.
already.
You're
Got red board? Yeah.
Okay, all right, good lots of support, excellent, okay. So you're at the head of the bed, you're in charge, you let us know how fast we need to go, and then if we're going too fast, okay? So you got the tube, it's secure, ready to go?
We've got a good pulse.
Okay,
We can
let's go
go.
team.
Okay, let's go. I'm on. We're going to OR 2, so we have to go into the east wing. Yep.
Oh, we gotta go through that construction, don't we?
Just, all right, good.
Yeah.
We're good.
Hold on to that tube, don't let it go. Okay.
Keep moving.
All right.
I'll grab the door.
Okay.
Okay. All right. You okay there? I got it, Roxy. Okay. Yeah.
All right, let's head to the elevator.
Yeah.
Yeah. Hands on the pulse. Don't let it go into the-
Go any faster?
Let us know it's just good. All right, what are we gonna do when we get in the elevator? Okay, let's have the bed go right down the middle.
Yep.
We want everybody on either side in case something goes wrong, we can react.
Yeah.
Okay, so what are you gonna do next?
So we have a
Reassess,
pulse.
we still have
Grab a
a
blood
Reassess.
pressure.
How's our airway?
Our air, we're getting chest rise. Can you also
Secure. We're breathing. You can move that chest. Okay.
Whoa, his heart rate's jumping.
Is it? Yeah.
It's ready too.
Starting to get tacky. Do you agree?
It's weak.
Annalise?
Yeah.
Do you have our shot?
Yeah, I got that.
Okay,
I'm about to say.
what do you want to do with this? So we have a pulse, it's tacky.
Can we shock it? If it's a
no.
shock,
No.
everybody.
It's
Still like normal sinus.
And we got a pulse, so.
Yeah.
We got a pulse. Can you
So we're tacky because we're probably low on fluid.
Oh, wow.
So what do you want to do? Yes, we can increase it.
Yeah. Perfect.
Not enough faster ring, and what will this do? What?
Again, 200. Yeah.
20 mil per kilo, no
Yeah.
ceiling.
Okay, we got that going.
Alright.
Let's go.
Yeah.
Good. Let's go. We're gonna go here down to the left.
Yeah, keep your hand on that pulse, because last thing we need to go into.
Are you doing up there?
Yep.
I'm gonna use a little slower.
Okay. Perfect. Is that good?
Get that trauma elevator ready to go there.
Will do.
Yeah.
Are you guys good on this? We'll go get the other.
Yeah, go ahead.
Oh,
You got the pulse?
Yeah, still got pulse.
Yeah, keep
Still
your hand
quick,
on the
but
pulse.
still have one.
Yeah. Keep your hand on that pulse.
Right around here.
Good.
Good. Okay.
Good?
Good? Hey guys, it gets narrow through here, so just
Okay.
watch our ends here.
Yep. Yep.
Okay.
Good.
Got it? You good, Laura? Okay.
Here we go. Good. Excellent.
Good.
Moving here.
We still haven't paused, it's just
Still weak?
weak, yeah.
Yeah. Okay, so around the corner. We're good? How you doing? Got the elevator? Yeah, got the elevator.
Excellent.
Okay. We'll go feet first.
Yeah.
Okay.
Good. Excellent. Okay, right down the middle. Make sure we're on both sides there, just in case we need to do any
Shift
interventions.
it towards you, Alex.
Yep.
Okay, so what do you want to do?
Reassess.
Reassess. Airway, how are we doing with airway?
We're good.
blood pressure over there,
Entry,
please?
no-
Just watch yourself there.
Breathing, are we moving the chest?
We're moving
Yep,
the
moving
chest.
in.
Good.
Okay, have a listen to the chest.
Still bilateral, sounds clear.
Okay, how's the circulation? Let's get a blood pressure.
Blood pressure.
Okay. All right. Yeah, we're still tacky there. We got to get to the OR there. We're probably
Might be hard to hear
losing
the
blood.
pressure, but
Okay. Well, as long as you got the pulse there, I'm happy. We got to get to that OR.
Yeah.
Okay, where you're
Okay.
going.
Yeah.
Yeah.
All right, let's head to the OR, guys.
Watch your back. Turn.
Okay.
Are you good?
Yep.
Let's get into
Okay, let's
the
go.
OR.
I'll just stop at the OR door. Keep down up.
Oh.
First rest, the OR is gonna be ready.
They should be ready. They actually want us quickly to try to communication. That's still good. 96, guys. Good job.
All right. Okay.
You good?
All right.
Billy, I'm one of the surgeons.
Great. Hi, Billy. I'm Dr. Bernie.
Ernie, nice to meet you.
Nice to meet you.
Guys, make sure you put your protective equipment on, your gowns, your hats, and then watch the sterile stuff as you come in, okay?
Okay, here you go ahead.
We'll
And,
get a report from you guys when you get it all set up, okay?
all right. Let's
Somebody on a
keep
pulse
moving,
valve there?
guys. Yeah, okay, we need someone on a
Keep
pulse.
somebody on a
so-
pulse.
Yeah, go ahead, yeah. Yeah. Okay, keep your hand on that pulse there. Yeah, we don't want to lose the pulse, so, yeah.
Annalise?
Good work.
Yeah. Down. Thank you.
Good, yeah. Excellent, excellent. Okay. All right. Nurse Roxy's gown up, and I'll
Coming.
throw on my hat and stuff,
Yeah.
and go ahead in there. Keep it feel for that pulse.
Hey, Billy.
Okay. And Alicia,
You guys all set in there?
Laura, we
We're
get
all
dressed
set.
up?
We're just
Okay.
waiting for you to come on in.
Yeah.
Okay.
Great. Good. Okay, when Nurse Roxy comes, you can take over pulse, you can take over bacon.
Sounds
Okay.
good, yeah.
Excellent. Good.
Put your feet off when you need it.
Thank you.
Get one on and then you can switch off.
Okay. Hold on to that seat there. Thank you. Yep.
Okay, good.
All right. Yep. Just gonna have that.
Okay.
Yep. All right, how we doing there, Laura?
Just grab your
Good?
gloves.
Yep. Can we open this side? Is that all right for here? There we go. Good.
All right, guys, let's start bringing them in.
Yep,
Yeah,
all right.
let's just pull some of this equipment here.
All right.
Okay.
Okay, guys, so we're gonna roll back after,
Yeah,
and then we're gonna go
guys,
feet first,
Yeah.
okay?
Sure.
You have the pulse?
All right, nice and easy, watch that too.
How are you, Annalise?
We're good,
Okay.
yeah.
Good, make sure nothing gets pulled.
You want to take pulse? I'll pull a bit.
Yep, okay, you hold the pulse, let's head right in.
Watch everything sterile, guys. Don't touch anything.
Yeah.
Watch the sterile stuff, guys.
Hi guys, I'm Dr. Waters, anesthesia.
Hi, Dr. Waters.
How about you guys pass me over your oxygen tubing, we'll get off your
Dr.
tank.
Bernie, can I get you to
Okay,
grab that
sure.
pulse for a minute?
Yeah, can you do that?
Coming at you guys. It's there.
Guys, I'm just going to do a quick assessment while you guys hand over a report, okay?
Okay, Laura, all right, I just wanna hand over the report.
So he's a 4-year-old in a motor vehicle
Nice and
accident.
loud so everybody can hear.
So 4-year-old boy, motor vehicle accident. He has contusions on his abdomen.
Yes,
He
sure.
went into PEA. We did rounds of compressions, haven't shocked. He's now tachycardic. He's given a total of 300 mils of fluid.
Okay.
Quite back home on there.
Yeah, that abdomen is super hard, guys.
So you guys have what size of tube is?
So we have a 4.
You have 4, 19 at the teeth, you have bilateral, 15.
For me,
Bilateral, yeah. Bilateral
Air entry, yeah.
Good air entry.
And it was pretty easy intubation.
Pretty easy intubation, but we still have C-spine precautions,
Yes.
is that right? Okay, that's great. Yep. Got it? Yep.
Oh, he has a bit, head's a bit soft on his back. Nothing on his back. There's no blast, no other injuries. Mainly the abdomen that's a little bit distended and rigid. Pulse is very faint and weak.
Okay, you guys just have one peripheral IV, is that right?
Just one, and it's small.
Okay.
Okay, we should get another one.
You need
Okay.
central probably.
Yeah,
Good.
we'll put access in.
All right.
Yeah. So
So
what we're
once
worried
you're
about,
done-
team, is potential spinal shock, hypovolemic maldistribution of fluids here throughout, with a large bleed in the abdomen, also leading to hypovolemic shock. So let's get ready to move over.
Yeah, let's move over, guys.
Okay.
Let's get him moved over. That I'm really concerned about that abdomen.
So you want me to
Okay.
grab that head?
Yeah, let's get this everything off him.
Okay. Let's move the stretcher over.
And we'll have to go down a little bit.
Just 1 second.
Yeah.
Okay.
Let me pull this.
Yep.
Alright, here we go. Nice and easy, guys. Can somebody put the brakes on there?
Yeah, watch the sterile stuff, guys.
Yep.
Great, and let's get it level with this bed.
Who has C-spine for the
Alright,
new?
you're fine, yeah.
Okay.
C-spine.
We're gonna move a little closer there. You okay if I move?
Yeah.
Okay. Okay, are we close as we're gonna get?
Yeah.
Okay, so we're coming over with the red board all the way,
Okay.
and then we'll log roll and then pull the red board out.
Okay.
Okay?
Yep.
Make sure everybody's
Got your
ready.
C-spine.
C-spine has the count. IV 1 sec. Good.
Ready? 3, 2, 1.
Slide. Good.
Great.
Just slide that out.
Good.
Are you okay there?
Yep.
All right.
Whoever's doing C-spines when you're ready, you're gonna call the shots.
Okay, I'll be the one that rolls. Okay, I'll pull the board. You're pulling the board. Okay.
3, 2, 1.
Forward.
Got him.
Right here. There you go.
3, 2, 1.
Good work, team.
Good. Excellent. Good job. All right, let's get him prepped for this surgery.
We'll get him hooked over onto the anesthetic gas machine.
And end of scenario.
All right.
So that just ended our simulation. Students will now debrief with Ernie Matchett and go over the outcomes, and anything that went really well, they'll reinforce. Anything that they made a mistake with, they'll have an opportunity to reflect and debrief on that. And I think Carl just has a few words before we end the live stream.
Well, thanks for joining us on this. This is our first time doing this, so we're happy that you can join us on this. Good energy, running around there is fun. I'm looking forward to the next step is, of course, the great learning that'll occur in terms of some of the things that they have, and maybe some of the things that they may have missed, and we'll kind of go from there. So thanks there again.
Yeah, thanks everybody, and again, thanks to LHSC Children's Hospital. Thanks for all the support from previous subject matter experts like Tammy Tessiman, Kathy Trokey, and Gary Tang from back about 10 years ago when we started this endeavor. So thanks again, and thanks for watching.